My main issue was breathing problems throughout my whole life. I had had issues with sleep apnea, and I also wanted to change the shape of my nose, but the biggest issue was the medically necessary part as well.
And what was your suggestion, Dr. Lighthall?
Based on what I saw with Vanessa, most of her problems were anatomic and could be treated with a rhinoplasty.
But as you mentioned, Vanessa, you wanted to do some cosmetic surgery as well?
Yes, and that's where Dr. Lighthall was especially the best choice because she was able to not only address the internal issues I had, but also the reshaping of my nose that I desired as well.
Talk to me about the procedure. How difficult was it? How long did it take?
The surgery typically takes somewhere between 2.5 to 3.5 hours. And we straighten the septum, which is the wall in the middle, as well as you can see from her photos, we reshape the outside of the nose based on patient preferences. So we have a discussion ahead of time about what they want.
Vanessa, there we do see the before and after pictures. How do you feel now?
I feel 100% better. I can breathe and sleep so much better at night. And as my husband will tell you, I definitely take a lot more selfies as well.
Yeah, I mean, just looking at the pictures that you sent to us, I mean, you do. What a difference. And it wasn't difficult, was it?
No, honestly, I don't regret it at all. I felt like the surgery recovery time was not very long at all, even though, you know, it'll take over probably about a year for it to fully recover, but I feel great.
That's what was the recovery like?
The first couple days were a little rough. I did have a lot of swelling, but Dr. Lighthall was impressed with the fact that my swelling went down pretty quickly on average. It was actually pretty quick.
Dr. Lighthall, how common is this type of problem?
Out of all the cosmetic treatments I do in the head and neck and surgery, this is the #1 surgery that I do, is kind of reshaping and also opening up the passageways of the nose.
And also, how do you determine if a patient needs surgery or a less invasive procedure?
Most of it's based on exam and the patient's history, and if they've had prior traumas or treatments, and really what their anatomy looks like. If we can offer a lesser surgery and give them good results, absolutely we will do that.